Hi, I'm Andrew Albright, a physical therapist here at the James, and today I'm going to talk to you about delaying those sudden urges to use the restroom and how to retrain your bladder to fill appropriately after your surgery. After your surgery and after having your catheter removed, your bladder needs to relearn how to fill. When the catheter is in, it is constantly emptying your bladder, and the bladder does not have to stretch to hold urine for you. At times, these urges can seem sudden, and at times this is just your bladder learning to fill back up and stretch. And it's normal for your bladder to respond this way after having a catheter in. So when the bladder starts to fill, any little stretch on the bladder wall can send a signal to your brain to let you know that it's time to empty. But not always is that the case. And not always is your bladder at full capacity. So now we have to learn to kind of work through those urges to use the restroom to allow your bladder to fill back up to capacity so that you're not going to the restroom every hour, every 2 hours. These urges can easily be delayed by just you doing some simple tricks. I want you to think of these sudden urges almost like a wave to ride. It can start small, grow in intensity, but then eventually will subside. Going to empty your bladder as soon as you feel these urges will make it harder to control these urges in the future. When you feel these urges, I want you to try these few steps before you use the restroom. Whatever it is that you're doing, I want you to stop and stay still, or sit down and stay very still. I want you to squeeze and relax, or contract and relax, your pelvic floor quickly 5 times in a row, or just contract and hold the pelvic floor. This actually sends a signal to your bladder to relax. Relax the rest of your body so that the bladder will follow. Take some nice deep breaths. This can help the body and muscles relax as well. And I want you to concentrate on feeling that urge subside, and then slowly take yourself to the restroom so that you're in control of your bladder. So in addition to these urge delay techniques, you can also try and distract yourself. Take your mind away from this urge. Sit down comfortably, take some nice deep breaths, and do some mindful activities. Feel your feet on the ground. Feel your legs on the chair. Feel your weight on the chair. Feel yourself sitting up nice and tall, while also incorporating those pelvic floor exercises we just talked about to delay the urge. Take those nice deep breaths nice and slow, in through your nose and out through your mouth. Try and think of something else. You can do a puzzle, you can play a game, you can sew. Do a mind task, crosswords, word searches. This helps you bring your focus to something else as opposed to that urge. And a lot of times it'll help it pass and allows your bladder to fill to more capacity. Do positive talk. It helps sometimes to just tell yourself you can do it. You are in control of your bladder. It is not in control of you. And it does help you kind of overcome that urge to use the restroom. And then hopefully that urge subsides. Wait a few minutes and then slowly take yourself to the restroom. Don't rush, because then the bladder is in control at that point. In addition to delaying that urge to use the restroom, it's important to allow that bladder to stretch, to delay the going, to allow the bladder to fill to more capacity, to give you time between emptying your bladder. When you feel sure that you're able to control those bladder urges to use the restroom, then let's take the next step and make that control even stronger. Instead of walking to the bathroom right after you control the urge, try waiting an extra 5 minutes. And then when you feel comfortable waiting that extra 5 minutes, let's add waiting 10 minutes the next time. If you feel like you are using the restroom 8, 10, 12 times throughout the day, try implementing these urge delay techniques to allow your bladder to fill a little bit more and give you time between voids so that you're not going 8, 10, 12 times a day. Your goal should be to empty your bladder every 3 or 4 hours throughout the day. Start by emptying your bladder every hour for a week. And every week after that, I want you to add 15, maybe even 30 minutes to that schedule. And each week after that, you're going to add another 15 or another 30 minutes after that, until you feel comfortable going 3 or 4 hours between voids. We really do not want you to go longer than 4 or 5 hours between emptying your bladder. The bladder does need to empty regularly to maintain a healthy bladder. Now let's talk about urge control at night. You will get bladder urges to use the restroom overnight. They will wake you up. When you wake up in the middle of the night with bladder urges to empty, it's important to try the steps that we just talked about to delay that urge as well. You can lie in bed, do a quick few pelvic floor contractions, or contract and hold, Let that urge subside and go back to sleep. If the urge does not go away after a couple minutes, slowly take yourself to the restroom, empty your bladder, and come back and go to bed. Remember to practice and be patient with this. Retraining your bladder is going to take time. Most people notice a change in bladder retraining within a couple weeks. Might be quicker for some, might be later for others. But keep it up and keep practicing. However, if you're having persistent urges despite trying these delay techniques and bladder retraining, you want to reach out to your medical team. You could have a urinary tract infection and they have medications that can help with that.